These are 5 common mistakes to avoid to keep yourself out of trouble with aligners. My name is Hisham. I'm a consultant orthodontist. I've been a dentist for 15 years and practicing orthodontics since 2013. I teach orthodontics to specialty trainees and to dentists, and I have a special interest in aligners. So these are 5 common mistakes which I have found I've made too frequently early on in my journey, and which I find that dentists are still making when I speak to them. The first mistake with aligner treatment is not staging the treatment properly during the simulation reviews. So that means we're not thinking about when the teeth are moving in a particular direction, which movements work together nicely, which movements shouldn't be planned at the same time, and maybe thinking about which teeth are moving at a particular time. So not staging the treatment properly will mean we're reducing the predictability of the tooth movements, and that will overall mean that the outcome that you're trying to deliver is going to be more difficult to achieve. So look at your simulation properly and make sure the staging and sequencing of the treatment is done nicely. That leads on to the second point, and that is that IPR is not delivered at the right time. In so many cases I've seen IPR is planned to be delivered at the beginning of the treatment, and usually that's when the teeth are the most crooked. Ideally, you want to deliver IPR when the teeth are really nice and straight, so it's easy for you to deliver. You can record and measure exactly how much you are performing, and it's also a much more comfortable experience for your patients and for your own practice as well. So performing IPR too early in treatment tends to be a no-no, tends to be difficult to deliver and almost impossible to measure predictably. The third thing is not using aligner chewies. Now this is basically a small piece of plastic or rubberized sort of chewing gum, and we ask patients to use this frequently during the aligner treatment. The whole point of the chewy is that it improves the engagement of the aligner with your teeth. So in other words, it pushes the aligner onto the teeth and improves the contact between the aligner plastic and the tooth surface. And the better the engagement between those two surfaces, the more predictable your treatment is going to be. So if you don't use chewies, chances are that your aligners are not going to be performing very well because the engagement is poor. So ask your patient to use the chewies as much as possible, and that will improve your surface contact and improve the engagement and therefore your treatment predictability as well. The fourth point is that patients are often using their aligners and swapping them too quickly. In other words, going from step 1 to step 2 to step 3 far too frequently. Now I know the aligner providers often say you can change the aligners as often as 7 days. In my experience, this is a little bit too quick. I don't find the aligners are expressing the full prescribed movement within that 7 days. So I tend to not really ask my patients to ever reduce their aligner change for anything less than 10 days. I often start at the 2 weeks mark, and as time goes on, you can reduce it once you have confidence in your patient's compliance, and also taking into account the particular stage that I'm at during the treatment. So if the tooth movement that I'm trying to deliver is more difficult, or if it's less predictable, then I will try to maintain a longer aligner wear and not drop down. Whereas actually, if the tooth movement is quite simple to perform, it's not a difficult type of movement for aligners to provide, then I might drop down to about 10 days, but I never really go less than that. Things might change, but for now, I never ever go to 7 days or less. The fifth mistake is not learning how to use elastics as part of the aligner treatment. Now, elastics seem to have a lot of myth and mystery surrounding them. And a lot of the questions I get asked on my courses or just by speaking to dentists is, what type of elastics should I use? When should I be using them? How do I use elastics? Really, they're not very difficult. Elastics provide a pulling force, whereas aligners provide a pushing force. So anywhere where you need to pull teeth along with the aligner, that's a good time to use the elastics. For example, if you're trying to extrude teeth, that's a movement where the aligner is trying to pull teeth out of the bone. That's quite difficult to achieve, so often we will use elastics to supplement that tooth movement and improve the predictability as a result of that. Elastics are also great for bootstrapping or trying to get ourselves out of problems. So we use it to troubleshoot and improve the tracking where things are going off track a little bit. And finally, I use elastics a lot whenever I take teeth out. That's because I'm trying to bodily move teeth into the extraction space, and that can be really helpful to use elastics to aid the root movement and not just get the crown tipping. So those are the 5 common mistakes which I've seen a lot in aligner cases, including my own, and I hope you found this useful. Try to avoid these mistakes and you should be able to deliver more predictable aligner treatment. Thanks.